Hey, it's Coach Mark, and I'm here to give you some tips about combating ankle instability. So, a lot of times those ankle sprains, weak ankles, if they're rolling on you, it's not necessarily a weak ligament or a joint issue, but it could be a matter of connection between your mind and the muscles down there. A lot of times it's a proprioception or balance issue. A lot of times it can be tight muscles in and around that joint or weak muscles in and around that joint. So a couple things that you could do at home self-care wise. One, again, if we want to try to improve some blood flow, circulation, and mobility in and around that joint, you can get yourself something like a massage stick and work on loosening it up just for a couple minutes, 1 to 2 minutes, a couple strokes at each part of that calf and Achilles tendon, front of your shin as well. Do that for, again, at least a minute, loosen it up, and then we can go into some active ankle mobility, just down in that half kneel position. We could try to flex forward, feel that motion in the ankle. If you're able to support your body weight, you can work on trying to walk your hands back towards your feet, keeping those feet flat, and do that a few repetitions for that to just increase some mobility at the ankle. Or if you need to do something from a standing position, you can step back and work on stretching out the back of your calf, Achilles tendon, and foot. Now, from there, we'll take it into some strengthening. We like to perform isometric strengthening here at the Ultimate Wellness Lab. So one thing that you can do from building up some isometric strength and stability, we do some hip abduction, taking a hip one leg away from your body. So we're gonna balance on one side, this right side. We'll take that left leg and push it out into a fixed object. Now the harder we push on the left, the more we have to stabilize on the right. We wanna keep that body nice and straight. You should feel that proprioception right from the bottom of that foot, your toes, bottom of your foot, all the way up through the ankle and all the way up through that right side. Now, again, 5 seconds, 10 seconds, many all the way up to 40 seconds in some of the holds that we do here. And obviously keeping both sides balanced or working on both sides. From there, if you're gonna move on from isometric strength training, then you can work on some balance and proprioception. I would start with just a flat level surface. If you can, work on lifting a leg up. Have something next to you, back of a chair, tabletop, countertop, to help you so you're not falling all over the place. Usually a guideline that we like to use is, can you hold it for a count of 10? Feel the muscle and really connect that mind and muscle connection. Can you feel everything down in that foot and ankle working? Right? Give it a count of 10, rest, maybe do 10 repetitions. If you want to advance, we could try to do some balance pad training. Again, it could be a thick pad that we're using here. It could be a folded up towel, a pillow, a blanket, something to just throw off the integrity of that surface so that it challenges your balance and stability a little bit more. So again, same rules apply. Have something next to you so you're not losing your balance, falling over. Again, work on trying to build that up to a 10-second hold or maybe beyond, and then you can do some repetitions on that to build that up. So some soft tissue, stretch therapy, some isometrics, isostrong, balance and proprioception. Those are things you could do at home, but again, as always, we're here to help. If you need any help with any of those areas, whether it's through our Smart Stretch Therapy service, our isostrong program, or Fit for Life, just reach out, let us know. We'd be happy to help. Take care, and I'll see you again next time.